think I found it out.
Good afternoon, everyone. If you could please put your name in the chat for attendance purposes. This meeting is being recorded just for note-taking purposes. Thank you.
Hi, Emily.
Hello.
So for some reason, my Connecticut email refused to allow me to connect with this Zoom call. So I have to do it on my phone.
Oh, interesting.
Yeah.
What did you do, Howard? This is Jan.
I'm
Hello.
not admitting anything publicly, but if you want to be my confidential psychiatrist, I'm happy to talk to you.
All right. Sounds good.
Mm.
Is anyone else having trouble with the Zoom link?
Is anybody else on?
Yeah, I just got a text from Claudio saying it's not working for him either.
Yeah,
Just trying to
the
figure it
state
out.
the state blocked it for some reason.
Emily, I had no issues.
Thank you. For those who are just joining, sorry, we're going through some technical problems with the Zoom link. We'll get started shortly. If you could please put your name in the chat for attendance if you have not yet.
Thanks, Emily. Surprising how well it works, really. Ever since I've been doing Zoom big time since the pandemic, and it works most of the time, not every time.
Okay, so while we figure out the technical difficulties, I'm going to go ahead and begin. So our first agenda item today is just a motion to approve the May minutes. Can I get a motion to approve any edits needed?
I move to admit it.
Thank
To approve.
you. Any second?
I'll second it.
Thank you. Okay, so I'm just going to dive into some administrative updates quickly while we're waiting. I know Claudio and both Senator Marr are having some technical difficulties. So let me go ahead and share screen. Okay, so the first update I'm going to be giving is on the UCC and Crisis Continuum Marketing Project. So for those who are able to attend our May meeting, we had presentations and updates from both Daydream Communications and United Way on the two separate marketing projects we have been working on in response to the youth mental health crisis. Daydream Communications is solely focusing their project on the UCC utilization and awareness, while United Way is focusing on the larger crisis continuum. The goal for both these projects is to raise awareness for crisis services for both when a youth is in crisis and prior. Since our last meeting in May, the work group met with both Daydream and United Way. Daydream shared their creative and media plans with the UCC leadership and marketing staff and is moving forward based on feedback from the group. They plan to have a photo shoot at one of the UCCs on June 28th. United Way met with the working group last week to talk through the draft marketing and content options. Based on feedback from the group, they have made adjustments and will be doing A/B testing with the draft materials. For next steps, both projects will meet within their working groups to provide updates, and I will be working on scheduling meetings with DCF and TCB leadership to review the draft materials. Both projects are set to have materials ready for the beginning of the school year. I'm going to pause there and let Howard chime in for anything you'd like to add.
And I think you did a great job, Emily. Let me just say that one of the secondary gains of this process is we're learning a lot about how the community understands, perceives the need for the crisis continuum. And we're starting to understand also the nature of the calls that are being accepted by United Way, and who's actually calling 988, the nature of those calls, and what they represent in terms of informing our planning around mental health care for young adults and for kids. And we're going to be doing a deeper dive into that. But I'm excited that these two marketing initiatives are aligned and going forward, and hopefully we will have a statewide marketing campaign that will start before the school year this summer.
Thank you. So next, I'm going to be providing 2 updates on some of the studies and reports we've been working on. Both of these passed in this past special session in 2025. So the first one is the UCC private insurance review. So as I mentioned, this fall in special session, the TCB passed legislation that requires the TCB in consultation from the behavioral health advocate, DCF, and the Department of Insurance to review private health insurance coverage for children's treatment of UCCs, identify any potential barriers to billing, and make recommendations. So some updates on this. We had convened a larger working group this past winter and since then sent out surveys to the 3 community UCCs asking about barriers to billing. From there, and last week, we concluded conversations with each of these UCCs, financial staff to ask further follow-up questions. These meetings included the behavioral health advocate, Howard, DCF, and DOI, and we will be looking to reconvene that larger group this summer to discuss our findings thus far. Howard, I'm not sure if you have anything else to add for this
No,
one.
you did great. That's great. Thank you.
And then the last one, which is actually kind of a part of the Crisis Continuum Marketing Project, is the Crisis Continuum Review, which also came out of the 2025 legislation. So we had met with the agencies and orgs involved last month to walk through some of the draft data needed for this report, looking at 2025 data mostly for crisis services. We are currently in the process of internally going through this data and will reconvene the working group in the next few weeks. So please stay tuned for more information regarding that. So that's all I have for administrative updates today. Senator Marr, I think you were able to log on now, so I apologize, but not sure if you have any opening remarks before we go to the next agenda item.
No, not Emily. Do not apologize. Thank you. My other computer was being wonky, so I had to switch over. Nice to be here with everyone, and I appreciate the fact that you took the reins and went ahead because we don't want to keep everyone waiting. We have important information that we want to hear today, and I know Claudio is on his way, but let's just keep going.
Okay.
Good afternoon, Senator Marr and
Oh,
team.
you're here.
I just
Yay.
joined. I had trouble with the Zoom link too, but I'm glad we're pushing ahead. So
Good, great.
thanks, everyone.
Thank you. Okay, so now that I'm done with administrative updates, unless Senator Marr and Claudio, you wanted to say anything else before we move on to the school billing updates from Civic Solutions Group?
No, I'd like to keep going just because of timing. So,
Okay.
yeah.
No problem. So I will give the floor to Brett and Aaron from Civic Solutions Group. We have been working with them on the Medicaid school billing piece that also came out of special session or the legislative session in 2025.
Hi there. Yeah, so my name is Zach Mitchell. I'm taking over for Brett and Aaron at the moment. For whatever reason, it will not let me share my screen. But anyway, all right. So since it's not doing that,
I can share. I have it up, so
okay.
that's helpful.
Yeah, I'll just let you know to switch slides when you can do it. Perfect. All right. So yeah, so we're Civic Solutions Group, and so what we're kind of tasked with at the moment is trying to figure out or looking through what the barriers are for why certain schools or any schools in Connecticut are not being able to bill for behavioral health. So if you can go to the next screen. So these are our contact information. So if anybody has any questions afterwards or anything like that, like it's all up on the contact information right there. So there's Aaron Link, Brett Shire, Mariah, Tamara, and then me, Zach Mitchell. So if you want to contact me at any time, let me know, and we can talk it through. But all right, next slide, please. So here's the scope review. Basically, what it is we want to streamline and make sure that all schools are able to bill for to get back the most federal reimbursement possible. So that's kind of what we're looking at. And we're working with DSS, we're working with the Department of Education in Connecticut, trying to figure out exactly like what the barriers are and why they're not being able to do it. And there's a variety of different reasons, and we're writing up a report right now. We're working on it, and we're getting the data from DSS and the Department of Education and trying to figure that out. So we're working on that at the moment. So that's the basic scope of everything that we're working through. Next slide. So for anybody who's like me, who just needs kind of like a little review with a graphic, here it is. So you've got your stakeholder engagement, data and analytics policy review, and then work group and legislative support. And then all that funnels right down into is a framework for addressing exactly what's going on. So we're going to put all of this into a report. So that's the plan. We've started it all. We're working through it. And so that's where we're at the moment. And then if you go to the next slide. So here's our progress update. So what we're going to do is we want to contact different schools. And once we get the data from DSS, so we got a lot of the data today. We just got it. So we're going to see exactly what's happening with that. And then we're going to contact them and develop a survey and try to figure out exactly what the barriers are and why behavioral health isn't being billed, isn't being claimed, stuff like that. And we're going to set up live meetings with schools. We're going to set up a survey. We're going to research approaches to increasing schools claiming federal reimbursement, because the more federal reimbursement that comes through, the better. And it's not difficult once you get after it. And once you start working through it, it seems super difficult at first with Medicaid because there's a lot of different avenues you have to go through, but it's once you really kind of get into it, it's not super bad. So that's the thing that we're trying to make sure that schools understand, that they have federal reimbursement money coming their way, as long as they can get it, and do it in a reasonable manner. Or a reasonably timely manner. So I understand that they're like it seems difficult at first, but after you start to really kind of work through it, it's not bad. So we're gathering DSS data from DSS. We're interviewing other states. We work with a lot of different states that claim behavioral health, seeing exactly what they do, how we can appropriate that to Connecticut for benchmarking purposes. And so we're already in phase one. We're already kind of in phase two. Phase one is kickoff and planning. Phase two is stakeholder engagement, data collection. So we're pretty much there at the most part. Phase three is the analysis and framework and development. And then phase four is just kind of the reporting, delivering to you all and letting you know, like drawing up a report so you can kind of look through it and see exactly what our findings were. Next slide, please. And this is the last slide. This is kind of just saying, all right, so this is where we're at. We've got phase one, kickoff and planning. I kind of already went through that. Phase two is stakeholder engagement, data collection. And then, so ongoing throughout the project, we're participation with you all. And if you all have any questions, anything at all, let us know. But at the moment, we're just drawing everything up. We don't have, well, I shouldn't say that. So what we're doing right now is we're gathering all the data, we're putting everything together, and but we'll keep you updated on these meetings as we're going through and be like, what our findings are, and then we're going to put it into a complete report so we can figure out a solution and hopefully get schools more money from federal reimbursement. And that's all I have at the moment. If anybody has any questions, certainly let me know. If not, and if you think of something later, our contact information is right there.
Thank you, Alice.
Hey, hi, Zach. Thanks. I just want to be clear on the differentiation when you say you're doing a study on billing for school-based behavioral health. There are private providers who currently bill in schools for behavioral health services, more therapy grants and things like that. And we're embedded in there. We're usually billing, for Medicaid, depending. And it's through DSS, but the location code is probably either the licenses with our the main clinic, or it might be billed at one of the schools. You're not talking about that kind of behavioral health billing, right? You're really talking about schools themselves billing for behavioral health, ABA, other, I don't know if they can bill for testing. I guess they can. That's what you mean, correct?
Correct. Yep.
Okay.
Yep. Exactly.
All right.
And then
Yeah, I would just recommend you to be clear on that, because I think those folks who might not understand the way business is done may think that you're also including information on that. And I think it could be clear, so it's not just billing for behavioral health services in schools billing for behavioral health services. Maybe that's the way you say it.
yep. Okay. Yep. All right. Yeah. Yeah. So it's like PT, OT, speech, behavioral services,
Yeah.
like psych,
Yeah.
stuff like that. So that's what I'm talking about. For sure.
Thanks, Senator Marr, then Dr. Powers, and then I see a few questions in the chat as well.
Oh, I think Dr. Powers was up before me, so I'll let you go first, Dr. Powers.
Thanks. Zach, thank you for that information. I got a couple, and I think my questions are building on Alice's. School district billing for Medicaid. Kids have maximum allowable sessions. And if they're getting private medically based services that are also billing for Medicaid, how does that work insofar as the total allowable for the contract year? Is it total allowable, hypothetically, 40 sessions of X, and they split it, or because it's educationally based? Because it's
educationally based, you're absolutely right. Like, so there's no, like, it depends on what the provider decides that they want. So there's no difference between if you're billing for Medicaid outside of the school district versus outside, like inside the school district. So they're like, it's all kind of combined, and it doesn't really, like, there's no maximum amount, like, so that's a lot of people ask that question, like, all right, so I'm getting Medicaid services outside the school district, plus I'm getting Medicaid services inside the school district. It does not matter. Like, so Medicaid will pay for that regardless.
Okay, let me
Is
just
that the
make sure I
question?
understand. I have a little bit more. Let me just restate that so I got it right. There is only one bucket of services, but there is no cap on those services.
Correct.
Okay, so, all right, that's important. When it comes down to authorizations, your Medicaid doesn't pay for educational services, right? They only pay for medically based.
Correct.
Okay, so you've got two different groups providing medically based services. How have you guys considered, or will you consider, who writes the reauthorizations? Because you got two different groups that may or may not communicate with each other sufficiently, yet there has to be reauthorization for service continuation.
Yes, and that I cannot speak on.
Okay, I'm flagging it just because I know in our center, we've got kids who are getting services in both places, and authorizations are fairly frequent for services like PT, OT, and speech.
Yeah.
Okay, thanks.
Emily, let's go to the chat because my question was answered. Thank you.
Okay. So the first question is from Jeff, and he asked are there any changes to Medicaid coming out of HR 1 that will impact access to behavioral health services in schools or billing for those services?
Is that for me?
Yes.
Oh, so I don't work for DSS. I'm not. So the only thing that's coming through I know is the fact that behavioral health is now allowing services to be paid for by Medicaid from other, like not on IEP or not like on a 504 plan or anything like that. So generally it was just 504 IEP. But that's the only thing that I'm aware of at the moment. I cannot speak for DSS about what exactly is going to be paid for, because also like they've just submitted to the CMS, Center for Medicaid, Medicare, to get those services cleared. And I don't think that has gotten approved as of yet. But that doesn't mean that they're not going to be approved in the future. If that answers the question, I'm not absolutely positive.
Yeah, no, thank you.
And I will say just quickly before going to the next question, we discuss the study in progress and updates every month in the school-based work group and the school billing subgroup where DSS attends monthly, if anyone is interested. But I'll pass the floor to Sarah for your question because it's a little long.
Well, hi, I put a bunch of hi, thank you. This is such an interesting topic, and I wanted to echo Michael's question about Dr. Power's question about, billing constraints. And this, I don't know, Zach, if this is, something you focused on, but we've certainly received some mixed feedback from the provider community. CCA has several lawyers. Center for Children's Advocacy, we're a statewide legal rights organization for children. We have several of our lawyers embedded in children's healthcare facilities, so we regularly train, consult with, and take referrals from healthcare providers to represent children where there's a legal barrier implicating their access to something they may otherwise be legally entitled to. That's my elevator speech on a medical legal partnership project. But one of the issues that has come up is this issue of billing for services that may be provided in both the school and in the community, right? For a lot of kids with more complex needs, or maybe even not so complex needs, that's not that uncommon, right? Maybe you need behavioral health in school and behavioral health in the community. Maybe you need PT in school and PT in the community. And we were hearing that there were barriers or perceived barriers to that. And it looks like there had been some requirement from DSS maybe last year to require the provision of IEPs for students so that they could see if there was duplicative service delivery, and then a retreat from that. And so I just wanted to put couple things. One, I put actually DSS's response to CCA. This comes from Dr. Jody Terranova, who's the medical director for DSS. And she told us and gave us this link to the updated provider bulletin. So I just wanted to make that available for folks so they can see that on this issue of, the billing reimbursement for services in both places. But I just wanted to put that on folks' radar because I hope that that's quote solved the problem, but I don't know. And I don't know if that remains a perceived barrier for providers or schools in billing for Medicaid services. So I just wanted to make folks aware of that concern. Some of you may have already experienced that. So that's why I wanted to put that in the chat.
Yes, thank you. Yeah, it's a perceived barrier. That's what it is for the most part.
It's a commonly identified perceived barrier, right? So I think, my only point, I guess, Zach, is as you go through your analysis, seeing if that comes up as a problem. I'd also be interested if any of the providers have experienced any barriers to billing for services that are also provided in school. So
And that's perfect. So I've seen that in the past. I haven't seen it in a while, but like that's awesome that you brought that up. Yeah, for sure, because we're definitely going to look into that and ask that particular question. It's great.
great.
Thank you.
Thank you.
Mm-hmm.
Can I jump in there to talk a little bit about that, Sarah? Just for clarity's sake, when you're talking about PT, OT, and let's say BCBA, all three services are very difficult to offer within an outpatient setting because there are multiple licenses that have to be received. So if you have a PT site or you have an OT work, you can do it. But like those of us who are treating, let's say we have at our autism center, we attempted to deliver those services, but we weren't able to really get there because of the enormous amount of licensing and difficulty. And the BCBA services are more difficult for us because the time frame of kids being available is after school and hiring people full time. So there's like there are real barriers to outpatient delivery unless you're specializing in that. And I don't know how many people here. I know Michael might have better info on that. But I think that there are also the thing that I'm afraid of around this discussion, which is an important discussion, and I think good, is that the work can't really be afforded by fee for service. And that would be, I hope, part of what this study would look at. How much money really can you bill within a day, and including the time to actually get the billing done.
For Medicaid, yeah. A reimbursement, I should say.
Are there any other questions for Zach? If not, I think we can move on to the next agenda item, which is another kind of overview of a scope of work on update on one of our school-based studies. So I will pass it over to Tom Kosker from Disability Rights CT.
All right, thank you very much, Emily. Can you hear me okay?
Yes.
I am just getting my screen sharing ready here. And let me know when that comes through.
All set.
Okay, awesome. All right, thank you very much. Again, my name is Tom Kosker. I'm an advocate with Disability Rights Connecticut. We've been tasked with kind of leading this subgroup. So I'm going to start off with just, wait a minute, let me advance the slides. So this is a quick agenda for my section of the meeting, kind of who is Disability Rights Connecticut briefly, a review of the legislation. kind of an overview, and we've had some discussion about, you know, what the legislation is asking us to do. So we'll just kind of go through that briefly. Our project plan, as we've been working on this, we started back in sort of late March, mid-late March, we started on the project. So just kind of go through our plan, our progress to date, and then some next steps. So here's who we are. Disability Rights, we're independent, statewide, nonprofit, protection and advocacy system. I see my little symbol copied over, blocked out some of my words in my slide. Isn't that lovely? And we provide legal advocacy, rights protection for people with disabilities. I've worked with many of you on this, in this meeting, on this call, but for those of you that don't know us, just wanted to give a brief overview. We do a lot of systemic work, systemic advocacy. We do some individual advocacy as well, along with monitoring, investigations. We really work across the lifespan from birth to death and across the range of disabilities that people might have. Specific to this sort of work, we did some investigations in 24 and 26, specifically on special education, both looking at in-state private providers and out-of-state private providers. And with those, actually, we partnered with the Office of the Child Advocate on those projects. Our staff at Disability Rights includes attorneys, advocates. We're actually a legal advocacy organization, so I work under the direction of an attorney. We have investigator support staff. Again, I'm Tom Kosker. I'm an advocate. I'm also a parent of a child with disabilities, which kind of got me into this world, you know, 18 years ago. He just graduated high school 2 nights ago. So we're on to the next step. Yay, big step in the process. Most of my work is focused on special education, some employment, abuse and neglect. So again, just a little overview. Digging into the legislation, this is kind of a brief synopsis, but we shall submit, the TCB shall submit a report by January 1st regarding behavioral health issues impacting students in the state receiving special education. There's kind of 2 bullets to it, and I'll give them a few more details in a second, but the first piece of it is around behavioral intervention methods used, and kind of requiring the feasibility and impacts or implications of requiring these providers to use evidence-based practices in these behavioral interventions. You'll see in a minute that mostly focuses on private providers and training staff to use those. The second piece of the project is around monitoring and random audits of restraint and seclusion, obviously very closely tied, these 2 topics, so by the State Department of Ed. This is the more detailed description, like word for word. I'm not going to read it, but you all will have access to this. But this is in Public Act 2567, Section 14, kind of the details of what we're tasked with doing in this subgroup. Again, yeah, I won't go into all the details, but feasibility and impact of requiring staff to be trained in evidence-based interventions. And there's a couple more little details there. I'll pause just for a second. People are reading it. And the second kind of chunk of it is around restraint and seclusion. Again, best practices for monitoring and random audits by State Department of Ed. There's kind of 5 little sub bullets in there that we'll kind of dig into as we do this work. Compilation of incidents, interventions by the department on schools or programs that have high incidents, enforcement of laws around restraint and seclusion. As most of you are aware, probably on this call, there's been some changes to law over the last number of years, changing definitions and such on restraint and seclusion. So just they want us to look at the enforcement of those laws, again, training, and potentially development of uniform rules and regulations on that. So that's the overview of what we have been tasked as a subgroup to do. Here's our plan. That's in process right now, but we developed a communications plan. We doing some evidence-based lit review, gray lit review, kind of some background work. We're in the process of doing our methodology and design of our tools, data collection tools, and in the process of recruiting for interviews, focus groups, and surveys. And you'll see, I'll go through the timeline on that in a minute. We're doing some data requests to different groups, conducting interviews, conduct focus groups, roll out the survey, analyze all the data, and then draft a report. I'll not spend too much time on every slide, but I did throw these up here for you guys, and you'll have access to these as needed. But again, communications plan that we've developed and submitted into TCB, to Emily and the crew at TAO. Again, part of the school-based work groups, the special education subgroup, kind of continually updating this group in meetings like this and the subgroup. Our lit review, again, is in process and actually nearing completion. Done a lot of lit review on evidence-based practices, covering lots of topics, as you might imagine. Great lit review on restraint exclusion laws, looking at other states, policy guidance, monitoring and auditing practices, legislation, litigation, lots of stuff. Through that is also part of that is obviously talking with the State Department of Ed and what's happening here in Connecticut, right? Looking at the rules and laws and kind of a snapshot of what's happening here in Connecticut around a lot of this. Next step with methodology, again, we develop some evaluation questions. Again, interviews with key stakeholders, which I'll get to in a few minutes. We're actually starting those next week. Focus groups and surveys. Recruitment, not too much to say about recruitment, but that's underway. I've reached out to some of you in this group and will continue to do so. Some data requests that we'll be doing and have already started. We've engaged with the State Department of Ed and their staff there, but type and prevalence of incidents of restraint exclusion, what kind of evidence-based interventions and trainings happening now in the state at schools. Again, we'll be talking to State Department, private providers, school districts, as well as other states. We're making connections with other states as well. On the interviews, we're looking at up to 20. We'll see how far we get with that, but we have different groups of people that we're looking to talk with, and those groups are outlined here. But some folks that are developers and trainers, some researchers that do research on this stuff, on evidence-based interventions. Also talking to educators, professionals, policymakers from other states that may have done a good job with this and have had success. Of course, folks in Connecticut, from behaviorists to educators, psychologists, etc. And then some auditors from other states. We'll obviously be talking to State Department of Ed auditors as well, but also auditors from other states and see what their processes are. Invitations are in process, and we're going to start conducting interviews next week, and those will carry on through the summer and potentially into September as we need to kind of deal with certain groups of these folks, and certainly in terms of the educators, timing is key, and you might catch them in summer. So July and August are tough for some of those groups. So some of those things might flow over into September, but most of the stuff we should be able to get done in June and July. Focus groups, here's our plan. We're looking at about 5 focus groups. Again, really this will explore the feasibility and impact of requiring that. So we want to get from these folks that might be in the positions to give us some input on what the barriers are, et cetera. We're working on our scripts for that right now. But the groups that we're looking at including are, again, private special ed providers, because that's part of the legislation, whether it's administrators, educators, behaviorists, including folks in transition programs, CSD staff I mentioned, local special ed professionals, LEA administrators, local education agency administrators, special ed directors, special education advocates. And again, I've reached out to some of you on this call, and we will continue to do so to get names of folks that we look to connect with and include both in the interviews and in the focus groups. And then we'll be conducting those planned July to, I say October is a little on the late side, but we should be wrapping them up before then. We also plan on doing a survey to kind of get into a little more detail on kind of a wider reach. And these are some of the groups that we're looking at connecting with: administrators, special ed directors, private providers, staff and administrators, again, behavior specialists, teachers, professionals that work in the area, in the space. So those are kind of the different groups. Some of this has come from all of you, some of it's come from our work on who we're going to connect with and reach out to. And once we get that developed, more likely July, August, we'll get that developed, and we'll get that out in kind of 2 waves. One to administrators, because we have a better chance of them being available in July and August or earlier on the side, and second wave to kind of educators and other professionals. So that's that survey piece. I feel like I'm spinning through this pretty quick, but hopefully this is going okay. So here's just kind of a snapshot of where we're at or where we've been and where we're going. So communication plans is completed. That's been submitted. On the lit reviews, we're mostly complete with those. We're kind of in the process of drafting up the literature brief on both of those areas. Methodology and design, some of that's done. We've developed a protocol that we've submitted. Interview scripts we're completed right now. We're just basically sending those out because we're going to be interviewing people next week. And we're drafting the focus group and survey tools, which are being informed by the interviews. So some of these things are kind of, there's a timeline on these in terms of like getting input from the interviews, and some key informants and people that work in this space will help us inform us on what kind of questions we might want to ask in focus groups in our survey. Again, recruitment's happening. We've already sent out our first wave of invites for interviews and more to come. And yeah, focus groups, we haven't done that yet, but we will. Same thing with surveys. That's that. And my last slide is kind of next steps after that. Again, data requests. We're drafting a list of requests for that, for data from them specifically. We met with the CSD already. Interviews, again, we got a few on the schedule already for next week. Continue to schedule more. Focus groups kind of July to October. Survey, I say July to November. So some of that will be analyzing data and such. So it's getting a little on the late side. And then, of course, we're drafting the report. We've created an outline already, and we'll started drafting some of the background sections right now. But most of the report writing will be done in the fall. So that's a very quick overview of a big project, and happy to take questions. And I know we presented this already to the special education subgroup. Or I'll say, wait, no, I got that wrong. The school-based work group, all the different work groups and subgroups. But the school-based work group, we presented this already. So I know many of you have already seen this and asked questions, but happy to take questions. Dr. Powers, you're muted still. You're still muted, Dr. Powers. Oh no, you're still muted. We can't hear you. I don't know if you can hear me. There we go. There we go. All right. No worries. No worries.
Okay, everything I said previously is pointless. So I may have misunderstood something, but the way I'm understanding it now, and correct me if I'm wrong, is that this project, this document, and your charge here is directed towards private providers. Do I have that wrong, or is that it?
No, you don't have that wrong. I mean, what we've talked about is, as the legislation is written, it has this, wonderful phrase that's in a lot of these legislative things, including but not limited to sort of stuff. But yes, it's utilized by private providers, and the feasibility impact of requiring staff to use those. So yes, it's directed mainly towards private providers, though, as we've talked in the school-based work group, the stuff that we come up with here will likely be applicable to students in other settings, including local school districts.
Okay, but that's not codified in the task in front of you, and I guess
this task is on private providers.
Yeah, and that's what my concern is, that the evidence, training and evidence-based interventions, do you believe it's being assumed that is happening in the public settings? Because my concern is clearly that is not happening sufficiently in the public settings.
Yeah, I would make no assumptions on that regard.
Okay.
And I would make no assumptions on my end, and I would make no assumptions. I mean, I'm sure your and I's feelings and position on that are probably quite in alignment, the disability rights and your own. But here's the task in front of us. So this is the task we're taking on. Whether this is able to be used later on to say this also could apply to other settings, as I said, is to be advocated for by others,
Okay.
If that makes sense. I mean, I think would be our spot position on it.
Yeah, well, to me, it not only makes sense, it's urgent. So
I don't disagree.
I'll put this out to the group here.
Yeah.
I had a kid last week with multiple thousands of self-injurious events in a day, and in a public school. So It's fresh, but this is something I've been concerned about the whole time with this. But thank you very much. I appreciate it.
Yep. Thank you, Dr. Rose. And again, we at Disability Rights Connecticut, and we take similar calls. We take similar calls and are aware of these things happening in a variety of settings. But this is the charge that we're tasked with right now. Senator Mar.
Yeah, just a quick question. I'm sure that you are, let me rephrase that. Is any of the work that was done on the special commission last year being utilized in this work?
Yeah, the Special Education Task Force, you mean?
Yes.
Yeah, so we're talking with those folks that issued that report, certainly, because some of that was the reason this is in legislation now, certainly, right? There were different reasons that led to this, and we actually met with Representative Khan, who was part of was the chair of the Special Education Committee at the legislature, who that report was presented to, among others, right?
And did you also speak with Senator Gadkar Wilcox?
Yeah,
Okay.
because she was the co-chair of that committee. Yeah,
right.
Yeah, so we'll be engaging with both them and the folks on that, and then we have the report. Obviously, I've read that multiple times. The report that you're talking about, Special Education Task Force, and pieces of that address this. Certainly.
Yeah.
Certainly.
Okay.
Yeah.
Just making sure.
No, I appreciate it, because actually, as we've been doing this work and we're engaged with this sort of work across, and we've had this conversation in our school-based work group in other settings, right? Like CBAC, the Children's Behavioral Health Advisory Committee, isn't specifically this, but there's lots of overlap on other pieces that folks in this call and different groups have done work on, and task force and issued reports. So we're certainly going to try to make sure that we don't. We're certainly not going to ignore those things and not duplicate the efforts, sort of thing. So
yeah, thank you.
Yeah, thank you. And Tammy.
So I see that this is, evidence-based interventions. A lot of times when interventions are being become evidence-based, they leave out people with intellectual disabilities, people with autism and other disabilities. How are you going to make sure that the disability community is included in this? I know there's a big NASD's report on how evidence-based practices are appropriate for people with disabilities, but it's really hard to find those. So how are you going to go about ensuring that these interventions can be then applied to people with disabilities? Oftentimes people with intellectual disabilities and autism or both get excluded from these types of when people look into these types of things, and they say, oh, it's good. These behavioral interventions are good for everybody, but then they're not accepted for people who have ID or people that have other types of disabilities.
Yeah, I guess I'll answer that in this way, in that what the evidence-based practice. Well, first of all, the project doesn't specify any particular disability or include or exclude any sort of disability, right? This is for students, special education students with behavioral health issues, right? We've had this conversation in our subgroup, so that may include a range of students with a range of disabilities, from mental health disabilities to autism to intellectual disabilities, other developmental disabilities, fill in the blank. So kind of we're looking at it from the broad lens of this should include any of those students. Now, to the extent that evidence-based interventions have been proven to be successful and useful for a particular population, well, that's based on what they've done in the research, right? And you're right that some of them have excluded some particular populations at times. So we will outline that. I mean, that's all we can do in that particular regard, right? Here's some evidence-based practices. Here's what they've been shown. And we're looking at what subgroups these are good for, whether they're subgroups of students with particular disabilities or by certain age groups, right? Certain practices might be better with certain age groups, different settings potentially. There's a lot of different factors that might come into play on whether something is helpful or not, right? Is evidence-based. So yeah, we're going to look at those factors, certainly. And those are the sorts of questions we're also asking in these interviews and in these focus groups is, what practices that you find to be, which of these evidence-based practices are you using, and which you find to be successful or not, or usable or not, or implementable or not, to different populations. So very good questions and things we're considering. I don't have an answer for you right now how we're going to frame that out, but that's sort of a little swing at it, if it makes sense. I hope that sort of answers your question. Any other questions?
It does. Thank you. I'm
Okay.
sorry, I couldn't find my mute button again.
Yeah, that's okay. That's okay. That's okay.
It does. Thank you.
Awesome. Thank you. And Tara, I see you got your mute button off. I see. I spied you down there.
I did.
Spied you down
Thank
there.
you.
Yeah. Yeah.
And I'm just going to bring this up as a point of clarification is for the larger group that we've discussed in more detail that when referencing behavioral health issues, what we're really referring to here and what you're examining more closely is the use of challenging behaviors. And that we're not talking about, co-occurring mental health disorders specifically, as sometimes Tammy will love this question because she often will ask, what's the definition of behavioral health that you're using? So I just wanted to say that that was a clarification that we received from RepCom that she was more interested in looking at challenging behaviors that are occurring that are leading to some of the restraint and seclusion. Am I correct on that, Tom?
Thank you, Tara. No, thank you.
Yes.
That's right. And I appreciate, I want to let you finish, but no, that's exactly right. We've had this conversation, thanks in large part to Tara, which we appreciate kind of raising it because it's an important one and clarification that we make sure we're on the right path and we know what we're working on. But yeah, as we engage with RepCon, who, helped draft the legislation, it's the challenging behaviors that are potentially leading to restraint and seclusion of students. And we're trying to what evidence-based practices can be used and utilized and put into place and train staff and how implementable they are, et cetera, to avoid and / reduce restraint and exclusion. And that's actually some of the conversations we're having with other states, like what other states have done some of these things, or what districts in Connecticut or which schools, right, or which programs have done those sorts of things in Connecticut that have helped reduce the reliance and the use of restraint and seclusion. So that's the angle of it, not like kind of the mental health side, though it may include any student with any sort of disability, whether it's mental health, autism, intellectual disability, or otherwise. I hope that clears that up. Thank you, Tara and Tammy.
I just wanted
Awesome.
to put, there was one question in the chat that
Oh
says,
yeah, I didn't even look at it.
do you have different interview scripts for professional groups versus caregivers?
Well, I'll answer that in kind of a couple ways. Caregiver being a phrase that can be used different ways. Everything, right? It's got these definitions, but I'll say we have different scripts for different groups. Yes. So the first answer is yes. Each of the groups that I mentioned, we have different scripts because we have different questions we want to ask and different things we want to get at, depending on the group of professionals, whether they're behaviorists or administrators or auditors or whatever, right? So we definitely have different scripts. When you say caregivers, and this was a conversation we've had, that caregivers are not, I'll be careful. The way I understand the term caregivers is not part of this, the scope of this project. So that we wouldn't be interviewing them anyway, unless you might have a different definition of caregiver than I do, but is the way I understand caregiver. They're not part of the project, which we talked about that in our subgroup. Because someone brought up, are you talking to families? You got to talk to families. I am family. I am a parent. Trust me, I completely understand and value the importance of getting the parent input. As part of this project, as you read it, the parent input is not part of it. Might it be a future part of it? Might be something that's asked about later, certainly, but it's not something that we've been tasked with here. So if you're thinking of caregivers as like parents and family and sort of thing, then no. I hope that answers it, Asima. Was there anything else in there? I didn't look and see other questions. The other ones were Sarah's from before. Okay.
Yeah.
Okay. Sarah, no questions for me, just questions for the billing. Okay. Yeah, fine enough. No love from Sarah today. Any other questions?
I don't
All
believe
right.
so.
Well, I hope that was useful and helpful. And again, we'll be staying in touch with our school-based work group, and obviously working closely with Emily and the rest of the crew. So anything comes up, and we'll be reaching out to some of y'all. I mean, some of you have already reached out to, and I will reach out to some of y'all because you have certain particular roles within this space that are helpful for us to connect with, whether it's helping us with reaching out and who's a list we can send surveys to, for example, or a list we can reach out to kind of engage people. Focus groups will reach out to you. So thanks so much.
Thank you.
Thank
Wait,
you.
I got to unshare. Hold on a second. Stop share.
Thank you so much, Tom.
You're
I
welcome. You're welcome.
appreciate your work. I think that actually brings us to the end of our agenda for today, which is amazing. We don't usually get through everything so quickly. I did want to thank everyone for being on today. Emily, are we purely virtual next month or not? I don't remember.
I will be sending an update in the next few weeks, hybrid, but possibly virtual once again.
Okay. All right. Great. So I just wanted to make sure that everybody has July 15th on their calendar. At that point, we're going to be having an update on Solnet, a briefing on Solnet. So it's really important. It has a lot of impact on our service provision. So I hope that everyone can be here to participate in that and bring your great questions. I always learn so much from the questions that you all ask. So thank you. Claudio, do you have anything?
No, Senator, I think you teed it up perfectly. Again, just really intrigued. We had two meaty topics today. I really enjoyed the back and forth with the school-based claiming and making sure we're maximizing revenue. It's been a little bit of a Gordian knot as we work through changes at the federal level, trying to navigate and maximize this opportunity, and also recognizing some of the operational barriers at the local and in the schools. So really encouraged by some of the progress we made there, and look forward to the Solnet briefing, which hopefully we have some good news to share. I know that it's been a work in progress, but certainly the DCF and the UConn folks have not lost sight of the importance of the mental health capacity build that's behind that strategic initiative. So thank you.
And back to you, Emily. Anything for the good of the group?
Like Senator Marr said, our next meeting will be July 15th, so just be on the lookout for any updates for that. And just so everyone knows, we don't have any TCB meetings for the month of August. However, we are tentatively planning a workshop to have the presentation of the Connecticut Children's Behavioral Health Provider Survey. Jill had come and presented earlier within this year, but we are in the final stages of that report. So that will be released at the July meeting, and we are hoping to have an in-person workshop to further discuss that in either late July or early August. So just be on the lookout for those two things.
Okay, great. Thank you so much for managing us all and getting us up and going despite some of our Zoom issues. We appreciate you. Enjoy your day. The rest